Good morning. This hearing will come to order. I want to welcome everyone to today's hearing, examining, that's a new word. We come up with one every time here. We're not going to examinate. We'll just examine today VA's management of its mail operations. VA reports spending by far the most in the federal government on mail, $355 million in fiscal year 2016. That's more than the Social Security Administration or the Treasury Department, including the IRS. Considering the magnitude of spending, the subcommittee looked into where the money goes. What we found surprised us. Every large agency reports its mail spending to the General Services Administration in great detail through what is called the SMART database. GSA posts the numbers on its public website. The general idea is transparency drives efficiency and savings. Let me repeat that. The general idea is that transparency drives efficiency and savings. In reality, after a look at the facility-by-facility data VA reported, bizarre and anomalous numbers immediately jumped out. It begged the question whether anyone had ever reviewed and questioned the information. Here are some of the highlights. The VBA office in Huntington, West Virginia, reported sending priority mail for 3 cents each, while the Memphis Medical Center reported spending $39 per piece of priority mail. The Alexandria, Louisiana Medical Center reported sending first-class letters for 8 cents each, while the Decatur, Georgia Medical Center reported sending the same letters for $58.29 each. The Denver Medical Center reported sending nearly 10,000 airmail packages and nearly 65,000 UPS ground packages at no cost. The VHA facilities in Temple and Waco, Texas, reported spending $40,000 to mail just 16 business reply letters. And finally, the Decatur, Georgia Medical Center also reported sending 1 FedEx ground package at a cost of $11,257. These numbers are hard to believe. In a letter to former Chairman Miller, VA explained them as data entry errors by mailroom employees. For example, VA wrote that priority mail in Memphis actually cost $3.90 each. The business reply letters in Temple and Waco cost a total of $40. The FedEx package indicator was really $112, and the first-class letters indicator never existed. These explanations were not very reassuring. More on that a little later. Recognizing the scope of the problem in the mail operation, we turned to GAO to conduct a wide-ranging review, and it released its report last month. VA seems to have a circular problem on its hands. The mail operation is bureaucratically fractured and governed by a 20-year-old policy. Hundreds of VA facilities are mailing using a hodgepodge of different meters, software, and other equipment. No one seems to be firmly in charge, and the extensive data collected every year is completely unreliable. The data is supposed to inform managerial improvements, but the managerial shortcomings seem to be corrupting the data. It is not clear to me that anyone truly knows how much VA really spends on mail. As big as the reported $355 million total is, it apparently does not include over 1,000 clinics, 300 vet centers, and the entire National Cemetery Administration, among others. Some facilities report nothing, while other facilities inflated their spending by a factor of 10 or 100, as VA explained. Patterns in VA's reported spending are just as perplexing. After being roughly in line with Social Security and Treasury's mail spending for a number of years, VA's reported spending abruptly spiked by over $100 million in fiscal year 2014 and has stayed at that level. In some years, expenditures crept up while the number of mailings dropped. In other years, the number of mailings climbed, but the expenditures barely budged. Notably, despite the spending spike beginning in 2014, the number of mailings is actually down. Perhaps what is most concerning is from the outside, before scrutiny, this all appears to be a model of efficiency and open government. A federal management regulation, detailed policy, and interactive data available to the public in an online dashboard. In reality, it is an intractable mess, a classic case of garbage in, garbage out. We are here today to shine a light on the problem and begin charting a course to fix it. While mail may not be the most exciting issue, these inefficiencies are clearly wasting real money. Veterans all over the country have pressing needs, and we simply cannot afford to operate this way anymore. I now yield to Ranking Member Custer for her opening statement.
Thank you, Chairman Bergman, and thank you to our witnesses and to all of you who have joined us today. While the case of the $11,257 package is a catchy title, it's actually one example of inaccurate data reporting by the VA. In this case, a decimal was forgotten during manual data entry, so a package costing $112.57 was reported incorrectly to the General Services Administration. Unfortunately, we observe this all too often. VA struggles with cost accounting and the management of its finances, in part due to outdated systems requiring manual data entry, increasing the risk of human error. Inconsistent procedures, policy, and oversight lead to a lack of accountability and increased costs to the taxpayer. Employees lack the training and resources they need and modern IT systems to ensure directives and policies are followed. Programs lack goals and measures of performance to gauge their effectiveness and efficiency, and data are inaccurately reported, this time to the GSA. These are the same root causes that resulted in the Veterans Health Administration's placement on the GAO high-risk list. These issues place VA's mail program at risk and causes me to question whether the physical security and accurate tracking of packages, some of those packages containing opioids and controlled substances, are at higher risk of diversion. In comparison to VA's other challenges, like addressing the opioid epidemic or ending veteran suicide, management of VA's mail expenditures and volume should be the least of its worries. However, I believe this is indicative of a larger problem. Military leaders often say that when troops are failing to do simple routine tasks, such as keeping their uniforms in order or maintaining clean barracks, and I think General Bergman would agree, that this is a sign of a larger problem. In the same way, I think failure to manage mail is one sign of a larger problem at the VA. The VA must thoroughly examine the root causes of GAO studies and IG investigations and take serious steps to address them so that it can transform itself into the world-class veteran-centric organization that we have all come to expect. I hope this hearing will give us a chance to have a broader discussion on some of these challenges that the VA faces and the solutions and resources that are needed to ensure that our veterans receive the health care and benefits they deserve. Thank you, General Bergman. I yield back.
Thank you, Ranking Member Custer. I would now like to welcome our panel who is seated at the witness table. On the panel, we have Mr. John Oswalt, Executive Director for Privacy in the VA Office of Information and Technology. We also have Ms. Lori Rectanis, Director for Physical Infrastructure Issues at GAO. Mr. Oswalt, you are now recognized for 5 minutes.
Good morning, Chairman Bergman, Ranking Member Custer, and distinguished members of the subcommittee. Thank you for this opportunity to participate in your hearing on GAO's mail management report entitled Actions Needed to More Effectively Manage Outgoing Mail, and discuss what actions VA is taking to implement the resulting recommendations and improve VA's mail management program. Before addressing the GAO findings, I'd like to emphasized again what was said in your opening statements, that VA has not paid the exorbitant amounts previously reported to mail individual packages and letters. For example, the $11,257 package reported to GSA was never translated into an actual purchase or expense for VA. The actual cost, as indicated, was $112.57. In this case and others, human error, such as omitting a decimal point, resulted in wildly inaccurate reporting on our part. Mail operations in VA are largely decentralized, with each administration executing their program to meet their unique and diverse needs. While these unique requirements require some degree of customization, there is a strong need for a robust enterprise-wide strategy. VA accepts and understands the need for immediate and decisive action, and we are acting accordingly. We have developed and undertaken a comprehensive remediation plan that addresses GAO's recommendations and to make VA a best practice across government and mail management. To better meet our mission, we must eliminate inefficiency that impedes serving our veterans, that the inefficiency siphons off valuable resources. As an organization that is primarily field-based, VA mail operations have evolved to meet the unique needs of our various components with limited central oversight. In the past, this homegrown approach may have worked to meet mailing requirements. However, the growth in mail volume over the past 2 decades, such as the shift to mail-out prescriptions, has rendered these homegrown mailing practices obsolete. VA has not kept up with new technologies and business practices. VA is working to create a more effective and efficient program and is using the GAO recommendations as our starting point. VA has established a department-wide integrated project team, or IPT, sponsored by the VA's Deputy Chief of Staff, with membership from all relevant stakeholders. The IPT is charged with formulating plans and actions that address and satisfy the GAO recommendations and to build the administrative infrastructure to govern the mail management program at an enterprise level. Actions include, but are not limited to, a comprehensive assessment and inventory of existing mail equipment and supporting software, conducting market research to determine what approach is best for VA, it's new capital investment, leasing, or obtaining mail operations as a managed service, conducting a cost-benefit analysis of all of these options identified, and we will make a determination on what approach best meets the needs of VA. VA has updated and has published a revised VA Directive 6340 that incorporates all new regulations and requirements. VA is currently updating VA Handbook 6340 that contains enterprise-wide operating specifications on how to implement the now revised policy. Individual administrations will write their own standard operating procedures, SOPs, that incorporate the unique mission requirements specific to their mailing operations. VA will report on a semi-annual basis the results of established goals and performance measures. VA is currently writing and classifying position descriptions for a dedicated VA mail manager position at an enterprise level and one supporting staff position. All mail managers will have to take annual mandatory training in accordance with Directive and Handbook 6340 and individual SOPs for their respective office. VA faces many challenges in meeting these goals, but we're up to the challenge. The men and women of VA are unique in government in their commitment and dedication to fulfilling the mission of VA, serving veterans and their beneficiaries. It is this dedication that will make our efforts here successful. There is a great deal of work to be done, and we are already making progress towards addressing GAO's concerns and are implementing their recommendations. This concludes my testimony, and I am prepared to answer any questions you or other members of the committee may have. Thank you.
Thank you, Mr. Oswalt. Ms. Rektunis, you are now recognized for 5 minutes.
Thank you. Chairman Bergman, Ranking Member Custer, and members of the subcommittee, thank you for the invitation to be here today to discuss VA's mail program. VA reports that it sends more than 200 million pieces of mail per year to veterans and their dependents, and it reported that it spent over $350 million to do that, nearly double what it did in 2009. In July, we reported that VA needs to take actions to more effectively manage this program. Specifically, we found improvements were needed in how it tracks mail data, how it measures program performance, and how it provides authority for key program officials. We are pleased that VA agreed to take action in response to our recommendations. The biggest issue is that currently VA cannot reliably demonstrate what it spends on mail or what volume it handles. This is because it does not consistently track mail volume and cost across its facilities and administrations. Instead, every facility essentially does its own thing. For example, some facilities use manual spreadsheets to track mail activity, while others had purchased equipment, such as postage meters, that track the volume and costs. However, even when the facilities had equipment, because the equipment had varying capabilities, the type of information provided by the equipment varied. This occurs because VA's administrations and facilities procure mailroom equipment independently. For example, each of VBA's 56 regional benefit offices negotiates their own contracts, and VHA reported that the contracts can be established either by the VISN or at the medical centers themselves. As a result, what you get is a department-wide roll-up that has little meaning. This is before you even consider the unreported, incomplete, or questionable data. While there are about 200 individual entities who report data to SMART, some key entities are not accounted for. We found the National Cemetery Administration hasn't reported its mail volume or cost, and when questioned, these officials did not know they were supposed to report. Additionally, VA's 1,000-plus community-based outpatient clinics do not report, and officials did not know if they were accounted for in others' reports. In other cases, those who did report missed critical items such as volume, expenditures, or undeliverable mail. Yet others reported data that were clearly inaccurate, as you have referred to, as another example, spending $9,000 to mail 29 pieces of mail. If VA strategically sourced equipment that consistently obtained and tracked mail activity, it would have complete, accurate, and reliable data, and it would likely save money by negotiating fewer contracts at higher levels of the department. While VBA is trying to establish a blanket purchase agreement, these efforts have not included other administrations in a way that would maximize cost savings, as well as help ensure a valid understanding of mail costs and volume. Regarding performance measures, VA cannot show that its mail operations are efficient and effective because it has not established department-wide goals and performance measures for operations. Instead, we found facilities, again, were doing their own thing for measures. Some facilities judge their performance based on customer service, while others reported using efficiency, cost, volume handled, or timeliness as measures. In the absence of department-wide measures that everyone works towards, VA can't assess how administrations or facilities are doing. Only through having performance measures and holding facilities accountable to those measures can VA show that it is effectively carrying out the program. Finally, we found that the officials responsible for managing VA's program likely have insufficient authority to do their jobs. We found a lack of clarity for who is responsible for carrying out the requirements in the mail policy. Mail managers also told us they do not believe they had the authority to even require basic operations, such as complying with requirements or ensuring accurate reporting. VA needs to clarify the authority and responsibilities of the agency and administration-level mail managers if it is to improve management and oversight of mail operations. In conclusion, VA has many critical responsibilities when it comes to serving our nation's veterans and their families, and must allocate its resources appropriately and efficiently and know that its efforts are achieving the intended outcomes. That includes mail. We look forward to working with VA as it implements our recommendations to enhance the effectiveness of its mail program. Chairman Bergman, Ranking Member Custer, and members of the subcommittee, that concludes my statement, and I would be pleased to answer your questions.
Thank you, Ms. Rectanis. The written statements of those who have just provided oral testimony will be entered into the hearing record. We will now proceed to questioning. Ranking Member Custer, you're recognized for 5 minutes.
Thank you. So this is a question about the GAO investigation. I'm wondering if you found evidence of fraud or waste in the mail mismanagement?
Thank you, Ranking Member. This review was not designed specifically to look for fraud, waste, or abuse, but certainly we did identify that when every facility orders their own equipment and does things differently, you probably are losing opportunities for cost savings from more strategic sourcing. In terms of fraud and abuse, anytime you have self-reported information and there's no oversight of that, you run the risk of that potentially happening. However, we did not specifically find any examples of that.
And it's my understanding that the mail procedures are based on a directive 6340 that is at least 20 years old. It might be older than that. Did you get into that level in your investigation?
The policy directive that we had at the time of our review was from 1996. Yes,
Okay.
there's a directive and then there's a handbook that supports the directive.
Do you know, or maybe for our witness from the VA, is there anything underway to revisit the mail directive and this issue about each of the facilities making their own decisions about what equipment to purchase without attention to cost savings? This is to the VA witness.
Oh, I'm sorry.
Yeah.
Well, as I indicated in my testimony, we have a cross-VA team now that is, the first step is to do the data gathering of what we actually have and get our arms around that. The goal being that we will have a centralized oversight of this, but still allow the field-based operations to tailor their individual programs to meet those needs. It's worth
But
mentioning.
something as basic as mail, why would that vary? I mean, why would it vary from VISN to VISN or region to region? We're just talking about, like, for example, you could have a volume discount contract with these carriers that would benefit everyone across the country and certainly benefit the taxpayers. You're never going to get that if you insist on doing this region by region in a different way.
I'm sorry if I was confusing that the administrations, the Veterans Health Administration, the VBA, the Veterans Benefits Administration, they each have their own programs. But within VHA, it's uniform the way they execute it, and the same for VBA. So there's
would just suggest-
VHA, excuse me.
I would just suggest we try to go up another level, and for the entire Veterans Administration all across the country, try to use the same equipment, get the same data, because you could negotiate an even larger discount for
Right,
the
and that
taxpayer.
is one of the goals we're striving for is VBA currently is, as indicated in the testimony of my colleague, is that VBA is now implementing a consolidation of their operations using commercially cloud-based software that rolls together all the disparate parts of information that is needed to report to GSA, and it does it for each carrier, and it puts it all into one place.
I mean, that's the irony. The carriers certainly know how much you spend,
Right.
that you could go the other direction. So I'm just suggesting that as you're looking into that, looking for ways of cost saving by getting a handle, you also have got to deal with this issue of manual entry. The more you're using digital entry, the better off you'll be.
Well,
Just weigh the package, let the machine, enter the information, because you're always going to have problems with manual entry. You're always going to have human error. And so my time is short, but I do want to get a question out there, and you may not be prepared to respond, but I would like to hear back from the VA. This goes to a much bigger issue, but my understanding is that 80% of the VA's prescriptions are handled by Consolidated Mail Outpatient Pharmacy. And I would assume that's a pretty large part of this $355 million, if 80% of the packages. Now, I would also assume that that's being done because people feel that mail-order pharmacy is a way to, for convenience, but primarily to save money. And I'm wondering, two questions. One, has the VA taken into account the cost of the mailing back and forth to determine if indeed there's cost savings through having this high a percentage. This seems like an incredibly high percentage for mail-order pharmacy. But secondly, I'm much more focused with the opioid crisis on managing controlled substances. We've spoken with the United States Postal Service, the issues that they're having with diversion. Do you have any kind of quality control around diversion? And my time is up, so
I will have to take
for
that for the record, and we'll
Thank
get back to the committee with that.
Thank you.
Thank you, Ranking Member Custer. Dr. Rowe, you are recognized for 5 minutes, sir.
Thank you, Mr. Chairman, and thank Chairman Bergman for holding a hearing on this issue. I'd also like to express my appreciation to our predecessor, Chairman Miller, who is keeping an eye on us from over my shoulder here for beginning the investigation. The mail spending figure we have, $355 million last year, is enormous, and I understand that there are major irregularities in the reported numbers, and the real amount could be even more or could be less. First of all, we need to figure out what the accurate total is. VA should be able to do that. Most businesses can. Maybe you clean up the smart data, or maybe the CFO counts expenditures, or maybe devise another solution. Then VA needs to look at waste and inefficiencies. The Social Security Administration communicates with 60 million beneficiaries, most of them seniors who still receive information via U.S. mail, for about $207 million. The IRS communicates with 140 million taxpayers by letter for about $188 million. I find it hard to believe that all the mail VA sends is absolutely necessary, which is why I've worked on a Retire Act legislation to encourage electronic delivery of retirement data for ERISA employees. I am interested if there are barriers to VA taking a similar approach. Even given the number of letters and packages that VA now sends, it appears that potential savings are being left on the table. Using hundreds of different meters, sorting facilities is incredibly inefficient. Imagine how much VA could reduce cost by leveraging economies of scale, as Ms. Custer just mentioned. Imagine how much easier it would be if all the equipment was compatible. Presumably, modern equipment, software equipment, can track all expenditures that pass through the meters and interface with the post office and shipping companies. As Chairman Bergman said, this problem does have a familiar theme. There's not enough oversight. There's not an oversight hearing yet in which IT or contracts do not come up with that. Just a couple of questions. Mr. Oswald, you first. I understand that last year all the VBA regional offices started working on getting a common contract in place to buy all their mailing equipment and software together. It was supposed to be done at the end of this year. Now VA is telling GAO it will take several more years. Can you explain why it's taking so long? And I also like the new strategy that you laid out to update the mail management, but why did it take a GAO report to get this done?
Well, I'll answer your first question first, sir. That VBA has instituted or begun this process, and I was informed by their officials that in a 3 to 9 month time frame, the software that they are purchasing and using on all the compatible equipment will be complete. And that will, as I indicated earlier, put all the information in one place. It will interface with GSA Smart and remove that human interface. It will interface with VA's own accounting system for more accurate data there.
Let me editorialize for just a second. Being in government space for a long time in medicine, we billed Medicaid and Medicare. If we had been this sloppy in reporting to Medicaid and Medicare, I can promise you, you would be doing a perp walk somewhere. You would not be able to put this kind of sloppy data in front of Medicaid and Medicare and expect to get reimbursed, and then expect not to explain this to the auditors when they came to your practice and looked at this. I mean, there's no way on this earth it would stand up to scrutiny. Just to editorialize. Ms. Rectonis, what would a world-class mail operation look like, and are there any other federal agencies that stand out that are doing this very well?
Thank you, sir. We did not do a comparative analysis for this review. Obviously, we did talk to GSA about which entities and organizations they thought were doing a better job. They were a little hesitant to identify key ones. But they did say that some of the challenges VA faces in terms of having good data and ensuring accuracy, they struggle with. But they did identify, again, sort of the best practices that you would want to see. Things like leveraging technology, things like seeking out the best discounts you can find, things like training, making sure all your folks have the training, and having a written policy that clearly lays out who's responsible and what your goals are. Again, one of the key requirements is having measures and targets and objectives to say this is what we're holding ourselves accountable to. I can provide you some information for the record in terms of if there are some agencies we think are really role model in this area.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. My time's expired, but I have a couple of questions I'd like to submit for the record.
Thank you, Dr. Rowe. Mr. Arrington, you are recognized for 5 minutes.
Mr. Chairman, thank you, and Ranking Member Custer for hosting or holding this hearing. I think while it may not be exciting to some people, I think it's incredibly important that we have effective and efficient operations for the federal government, especially when you're a service organization, especially when you're serving our heroes. And I am incredibly discouraged by the consistent feedback on IT, on union time, disability claim disputes, and the list goes on and on, with a pattern of lack of management. Who's responsible? Do they have the authority? Do they have the resources? Are there goals? Are there performance measures? Are there reviews to see if we're doing a good job? I feel like the taxpayer is being fleeced over and over because of the lack of this not so exciting issue of operations and management. The core issue, and I agree with Ms. Custer, this is just a symptom of the root problem, and that's lack of accountability. Now, I hope and pray to God that this accountability act that we all passed and signed by the President will give the tools to this administration and to you, Mr. Oswald, and your colleagues to actually do the job you were hired to do on behalf of the taxpayer and the veteran, okay? So I hope, but you know, once somebody has the tools and they're empowered, I think now you can hold them accountable with a good conscience. That's how I feel about this. When did Mr. Oswald, when did we know about this problem of either inconsistent, unreliable data collection and data outcome, and just the mismanagement of the mailing operation in general?
Sir, I don't believe there was any one moment where it was an aha moment. As I indicated, the mail program has been in place for a long time. I think Chairman Miller's letter to VA a couple years ago was when it really started to roll and we really started to gain traction. And there are individuals within VA who have tried to raise this as an issue, but the course of events has just overtaken it. But Chairman Miller's letter.
So a year ago when he wrote the letter, but it seems like this has been going on for many years, and so I'm concerned when it takes the chairman of a congressional committee to inquire about mailing operations before somebody wakes up and says, we're not managing this very well. We're wasting a bunch of money. So that's number one. So what, I assume, Ms. Rectinus, that there are best practices. I read something about GSA rolling out some best practice government-wide. Did that best practice initiative have any effect government-wide, and why didn't VA join that initiative to make their mailing operations more effective, cost-effective?
GSA has put out regulations in the FMR that are sort of at the fundamental minimum, if you will, of what a government mail management program should be. However, there is lots of information out there about best practices. GSA cannot compel agencies to do more than what's in the management regulation, and yet they try to encourage, they provide training, they do some education, they provide bulletins, but they do not have oversight or enforcement authority to force agencies to do anything more than kind of what's the basic information.
Well, because if they're, I think the school of thought by most folks who have run anything would be if you at least compare yourself to others and you're that far out of whack, somebody ought to probably lose their job, and then they ought to implement some reforms in that process. But clearly, that hasn't happened. We were talking about improper payments the last time I sat at this table in an oversight hearing, and my question was, who's responsible ultimately for improper payments? And they said 7 CFOs. If there's more than one person, then nobody's responsible. And I asked, when's the last time somebody lost their job over improper payments? And I said, get back to the committee on it. Nobody's lost their job on that. Here's my question. I'll leave you some time to answer it, Mr. Oswald. Who's responsible for the mailing operation? Who reports to the secretary? And then who reports to that person? Give me that org chart flow, and then I would ask you to submit to the committee the last time somebody was fired on account of not managing the mailing operation.
Okay, I will take that for
And
the
would you respond?
Well, as indicated, it's a decentralized program, so each administration head, each undersecretary has the authority for their program or staff office head. And then there's on the need to have a VA enterprise-wide mail manager, which currently is under the CIO's position. That's a coordinating policy role.
I've gone over my time. I yield back, and if there are time for further questions, Mr. Chairman, I'd be happy to continue down this line of thinking.
Thank you, Mr. Arrington. Mr. Poliquin, you are recognized for 5 minutes.
Thank you, Mr. Chairman. Appreciate it very much. Thank you, Mr. Oswald, for being here, and thank you also from the folks from the GAO. Mr. Oswald, how long have you been at the VA?
31 years.
I'm sorry?
31 years.
31 years. Okay. Have you been involved in this part of the VA for 31 years?
No, sir.
Okay. How long have you been in this position?
I've been in my current position for just over 2 years.
Okay. And to follow up with what Mr. Aronson was saying, does all of the mail operations report to you?
No, sir.
Okay. So what's your relationship with the mail operations around the country?
I am executive in the organization, Quality, Privacy, and Risk, which has responsibility for the enterprise mail function.
Okay, so you're supposed to make sure that the taxpayers aren't getting ripped off when it comes to the cost of the mail programs around the country, right?
That as a VA employee in general, yes, sir.
Okay, great. So if I understand you correctly, all the VA facilities around the country operate autonomously when it comes to mail programs, right?
They operate within their own administration.
Okay, great. Now, to send a first-class letter anywhere in the country, what's it cost? I mean, it's your job, right? You should know it's 49 cents, isn't it?
That's, and yes, sir.
Okay, well, I'm surprised you didn't know that. Okay. It's 49 cents to send a letter from me to Jody, from me for the chairman, or from me to you. Okay. Now, will someone explain this to me? In Alexandria, Virginia, they sent 3,713,070 first-class letters for a cost of 8 cents each. How's that possible? Oh, wait a minute. In Decatur, Alabama, they sent 712,695 first-class letters costing $58.29 each. What's going on here?
That is, as I indicated in my testimony, that's probably most likely, I would say, due to errors in the manual entry into the GSA Smart.
Okay, who's responsible for overseeing that? Is that you?
No, sir.
Okay, who is it?
The individual mail managers within the administration.
Does this make any sense to you over at the GOA?
Yes, and I appreciate if I could get a chance to comment.
Please.
Obviously, if you start to dissect the data too much, you really don't have a lot of faith, because it's not just the number, the piece per rate, or the rate per piece is a derived figure based on what's been put in for expenditures and volumes. So if any of those numbers are wrong in any perspective, then the rate per piece is inaccurate.
So you're
But it is
telling us,
important-
ma'am, that the data that the VA has submitted to us in our oversight to make sure the taxpayers and our veterans aren't getting ripped off is wrong.
It's self-reported data.
It's self-reported data.
but that
It doesn't come through
it-
you, it comes through these folks.
I'm sorry?
It comes not through you, but through these folks, right?
I'm sorry, I didn't hear.
It does not come through you. The data we have comes through Mr. Oswald.
It's directly reported by VA through the GSA Smart Tool.
Okay, so with the data all over the map here, for example, you folks over at the VA sent out 200, what the heck is it? It doesn't matter, 200,000, 225,000 pieces of mail, 220,000 pieces of mail, and it cost the taxpayers $355 million a couple years ago. Whereas Treasury and Social Security sends out more mail, but costs a lot less. Okay, so right off, as a former state treasurer up in Maine, and standing up for our veterans so we make sure we have every dollar they deserve to take care of them when they come back from the battlefield, I'm looking at this and I'm saying, how could this possibly be? And you're just confirming that. This is self-reported data, and there's nobody at the top that's watching this. Is that right?
Are you asking?
Yeah, I am. Well, no, and I'll ask Mr. Oswald. Mr. Oswald.
The self-reported data are made in such a way that it is impossible for anyone to confirm the accuracy of that data. That being said, however, it is possible to have different prices because each location works discounts with its service provider.
You mean like this price? In Waco, Texas, $40,000 spent on 16 pieces of business reply mail, or $2,500 per letter. That's what you mean, right? So that's $2,500 bucks.
Extreme,
Supposed to
correct.
cost
Correct.
49 cents. This is 25. So how in the heck, Mr. Oswald, you've been here for 31 years, 2 years in this job, how in the world can we trust this data? What in the world is going on over there?
Well, that's the reason we are undertaking this top-to-bottom reform, sir, because of these problems that have been identified.
How long has these problems been identified? Is this the first you've heard of it?
When the Chairman Miller's letter arrived, that was the first exposure I had to this issue. Yes, sir.
Well, who had the job before you?
The job didn't exist.
The job didn't exist before 2 years ago. So we're spending $355 million a year on mail throughout the VA system, and nobody thought that it would be a good idea to make sure people are looking out for the taxpayer and for our veterans. Is that what you're saying?
No, sir, that's not what I'm saying.
Tell me what you're saying.
I'm saying that each individual administration has their own appropriation, and they have the stewardship over those funds, and they, in turn, manage the mail program. From an enterprise-wide standpoint, the oversight was lacking, and that's what we're trying to correct now through various types of actions we're taking.
Now we're getting somewhere, Mr. Chairman. Finally, someone who is responsible for this mess and this lack of information, this inconsistency, and this waste admits that there's been no oversight. Good. Too bad it took this long to do it. I yield back my time.
Thank you, Mr. Poliquin. Ms. Rectanis, you have been very clear that the mail data is still unreliable. In January 2016, the committee asked VA to fix some of the most egregious problems with the reported data, and in March 2016, VA committed to do so. Yet it seems like some of the problems the committee staff found continue to exist to this day. Can you explain what's going on here, what's still wrong?
We confirmed for some of the commitments that VA made in its letter that they carried through on those. They did provide training to their folks on how to submit data. We did look at some of the numbers that the chairman had identified and saw that they had changed. Our bigger question was just because they changed, it doesn't mean that they're necessarily correct. Some had not changed. So I think what's the problem is that when every facility is doing their own thing, they're not operating under consistent definitions, they have different input data, it's very difficult for them to go in and fix it because they don't even necessarily know whether the new data they're putting in is any good.
Okay. Do we know, are all the facilities reporting?
At this point, we know that there are 200 entities who report. There are 400 authorized users throughout VA. And if you just start doing the math, you know that there are 1,000 CBOCs that we can't find in there. There are 170 medical centers and less than 170 reports. So we know that there are some that are not reporting. What we don't know is whether they're reporting through some other means. The CMOPs started to report in 2014. We have some sense that most of them report. What was happening with them before 2014 and all those prescriptions, we don't know.
Okay. Mr. Oswald, you stated that this was, now my words, a decentralized program.
Yes, sir.
Is it time for a centralized program?
It is time for more central oversight. Yes, sir.
That's not what I asked.
I would say that given the disparity in what each administration handles versus, mailing prescriptions versus mailing.
Let me repeat my question. We have seen that the decentralization has not worked, even from the standpoint of reporting, regardless of the expenditures. Is it time for a centralized program? Because mail is mail. Shipping costs, if you will, through the mail are pretty much whether you mail it from your house or mail it from your business or mail it from your government office. Is it time for a centralized look? By the way, I'm a big fan of decentralization of operations. As a Marine, when I'm in the field, I don't want higher headquarters getting in my decision loop because they're not boots on the ground. But I guarantee you there are times that they need to be in the loop because they have the bigger picture and are going to make sure that I have the supplies and our Marines and have the supplies they need to do the fight. So I'm going to ask one more time. Is it time for a centralized approach from the VA?
I will answer, sir, by saying that in meeting the recommendations of GAO, where they are asking us to examine different ways of procuring information, yes, it's time to centralize activities like procurement and reporting. The individual operations, I don't think as you indicated, a centralized authority is best to do day-to-day operations, but for procurement.
Well, you mentioned in your statement about going to a cloud-based approach.
Yes, sir.
Is there any entity that you know of at the whatever reporting level within your system that doesn't understand what the cloud is?
I think that's fairly well understood, sir.
Okay, so we take the tools that we have today as opposed to the tools we had 10 years ago or 20 years ago or even 5 years ago and utilize them to decide at what level of centralization our operations should occur. This is probably leading the witness, but Mr. Oswald, do you truly believe that the mail operations in the VA are effective and efficient at this point?
No, sir, they're not.
Okay. So what is it going to take?
I think it's going to take a centralization of oversight and reporting, as we indicated. Plus, it's also going to take redoing our business processes and our practices. As I indicated in my testimony, we let it go to seed. We were asleep at the switch and let this behemoth just kind of go where it went. But now we've seen the light, and working with our GAO partners in GSA, we are bringing it back under a centralized authority for that. And it's going to take technology. As I indicated, VBA is currently implementing a 3 to 9 month plan to centralize under Secretary there all of their mail operations and not have 56 regional offices doing their own thing.
Well, again, there's a difference between centralized oversight and centralized authority and centralized execution. And I can't even say that right. But, I see my time has expired. I know I've talked to the ranking member here. She does not have any more questions, but Mr. Arrington, you said, is there anyone else who would like to do, if you will, a second round?
I'll defer to the chairman because he may have to go and I've got the time to stay, so, okay. Mr. Chairman, if I may.
You're recognized for 5 minutes.
Again, I appreciate you guys being here. Wasn't there supposed to be an IT person on this panel today?
I work in the Office of Information Technology.
Okay, I thought there was a third panelist, but maybe I misread that. So when it was you said that it's been decentralized, the mailing operations over the years, and that the enterprise-wide point of accountability and oversight prior to whatever new plan we're going to come up with was the IT officer, the CIO?
The CIO is the ultimate accountable official, the senior agency official.
And how long has the CIO been in his or her position?
There is an acting CIO who has been in place since January.
And prior to that?
The former CIO, she was in place, I think, approximately 2 years before the change of administration.
And is that a political position?
Yes, sir.
And what about the career deputy to the political? How long has that person been in there? The senior-most career person?
The current, the incumbent of that position now, she has been in that position probably, I would say, for 4 months. Prior to that, it was the acting CIO now is technically in that position.
So how long was the current acting?
He was in that position for a year, and before that, the other principal deputy assistant secretary was in the position for, I think, approximately 8 years.
You know, there's not a lot of continuity. That's a problem, obviously. Because you would assume somebody with the pay that they receive as a CIO, career or political, and the tremendous responsibility to oversee the many aspects of that job, including, in this case, the mail operations, that they would have run some report or asked that question prior to the chairman of a congressional committee sending a letter and then uncovering that we've had years of mismanagement or no management of the mailing operation. So that's extremely disconcerting to me. I appreciate what you said, Mr. Oswald. Sometimes I just need to hear that the folks at that table are hearing us and that they agree and that they own it. And to say that y'all have been asleep at the switch is refreshing to me. And I want to commend you for saying that. We need to hear more people sort of fess up to the dysfunction at this department. And again, I sure hope that our current secretary will roll up his sleeves and begin fixing these things. What's the plan? Do you have a plan?
As indicated, right now we're gathering what we have. We don't know what we have on a top to bottom listing of hardware and other assets. We're in the midst of that right now.
So I think it's wise to gather information and all that. It's been 2 years. I wouldn't even come to that table without saying, here's the plan. We're going to centralize this oversight. We're going to restructure this. We're going to put controls in place. We're going to have authority where there didn't exist. We're having performance measures. I wouldn't come to this table without a plan if I were showing up at an oversight hearing. I wouldn't. And if I were the secretary, and I would be so embarrassed by this, I probably would show up and say, guys, I just want you to know this preceded me, and I'm going to come with a plan, and let me articulate the framework of that plan. 2 years. We ought to have a plan. I understand you got to gather information.
Well, that's just one aspect of the plan, sir.
Okay, so you feel like you do have a plan.
Right. We are bound to report back to GSA in 60 days from the issuance of the report, and we will have a project plan in place with dates at that time.
Okay. And who's going to be accountable to the secretary on this?
The direction of the creation of this integrated project team came from the VA Chief of Staff herself, under the sponsorship of the Deputy Chief of Staff. I'm kind of the point person on gathering.
Is the CIO going to continue to be responsible
For
to
the
report
time being,
to the secretary on this issue?
Yes, sir. As indicated, we just updated our 20-year-old policy, and that contains that the CIO position, the Assistant Secretary for IT, is the responsible official.
I love what Peter Drucker says, what gets measured gets done. And obviously, the converse is true. If you're not measuring it, it's not getting done. Too much is not getting done at the VA, and the taxpayers are being fleeced, and the veterans aren't being served by that. I hope the next time we meet, the plan is being implemented and executed, and adjustments are being made, and the outcomes are provable that we are providing cost-effective mailing operations. Thank you.
Thanks. Mr. Poliquin, you're recognized for 5 minutes.
Thank you very much, Mr. Chairman. Thank you again, Mr. Oswald, for being so candid. And I want to follow up with some of what Mr. Arrington said. He is spot on. If I heard you correctly, the CIO is the head banana that's responsible for reporting to Mr. Shulkin when it comes to this issue. And that is likely to continue to be the case from what I heard a moment ago. Is that correct?
That is my current understanding of the
Okay.
policy direction, yes.
Okay. And you named 2 or 3 different individuals, not their names, but 2 or 3 individuals who have been acting CIOs for a period of time.
Correct.
Okay. What are the names of those people?
The current acting CIO is Mr. Rob Thomas.
Okay. And before that?
It was in a political position, Ms. Laverne Council.
And before that?
The confirmed CIO was Roger Baker, but then after he left, there was an interim of Stephen Warren.
Okay, so there are 4 people you mentioned. It probably goes back 10 years, roughly.
Yes.
Okay, and are those political appointees? I didn't,
It is a political position.
Okay.
2 of the individuals were political appointees, and
Okay.
the other 2 were career.
are those 4 people that have overseen this mess still at the VA? Any of them?
Mr. Thomas is still a VA employee, yes, sir.
And he's the acting CIO now, correct?
Correct.
Okay, so he was involved in this, and he's still at the VA?
I don't know to what level he was involved in it, sir.
But he was responsible because he was the active CIO, right? And he reports to the secretary about this issue. So he was the head person involved in this when nothing has happened, and he's still at the VA.
He is currently the official, sir. He's been in the position since January.
Okay, his name again is?
Rob Thomas.
Okay, thank you. Let me ask you a couple questions, if I can, Mr. Oswald. Out of Decatur, Georgia, the VA reported that there was a package shipped for $11,257, but later the VA explained to us that it was actually $112. Okay? Is that your understanding?
Yes, sir.
Okay, what was in that package?
I do
What
not
cost
know.
$112?
Sir, I do not know. We could try and find.
Would
that
Mr.
out for the
Thompson
record.
know?
No, sir, he would not know.
Okay, but he's responsible.
He is not responsible for the contents of the package.
Are you?
No, sir.
Okay, but if we wrote to Mr. Thompson or to you, you could find out what was in that package for us.
I will work with the Veterans Health Administration to find out, sir.
In other words, you'll get an answer for us. Work with means you get an answer for us, right?
I will try and find out the contents, yes, sir.
Good, thank you. How did you make a mistake from $11,257 to $112? How's that possible?
It, in the SMART database, does not automatically put in the decimal point.
So it's not that smart, is it?
That's,
Okay, so you have a system that's supposed to track all this stuff that doesn't use decimal points.
it's not like with an ATM where you're getting out $400 and at first it's 40 cents, $4, 40. It does not go right.
Okay, so is that in your plan to fix?
With the, oh, sorry.
Yes.
Well, I was going to say, that's the GSA tool. The GSA tool in the instructions says, do not put in decimal points.
Okay, you going to
Put
fix
in
this?
11246, it's going to show up as a whole number, not
Yeah. Are you going to fix this? Who's going to fix
GSA
it?
has provided instructions to people to not put in decimal points and to round.
Whose people? At your shop or your shop?
At
This is
GSA.
GSA.
At GSA.
They have-
And my understanding too is they are, there's a new version of SMART being.
Okay, I hope it's smarter than the current version of Smart. Are you going to fix this or not? The GAO are you going to fix this or not?
GSA is
GSA.
on deck to fix this, yeah.
You're going to fix it. Okay, good. So we're on the record, you're going to fix it. Good. We're getting someplace. All right, Mr. Oswald, I mentioned this to you earlier before. In Louisiana, in Alexandria, Louisiana, they were sending out first-class mail for 8 cents each, but a stamp cost 49 cents. Is there any bulk mail operation in the country you know about that can send stuff out for 8 cents?
I do not know of any right now, sir, but
Okay, so how do you explain this?
I would either, it was the result of a negotiated pricing schedule due to volume, or again, it could have been an error in the SMART database. I do not know, but I will try and find out for the record, sir.
Yeah, okay, good. Kate, we're going to be in touch with Mr. Oswald's office, make sure we get that answer, too. It sounds like there's a real lack of not only accountability, but the ability to track these issues accurately, and then you come to us and ask for $186 billion to fund the VA. You come to us for taxpayer money when the VA is supposed to be responsible for taking care of our kids that come back from the battlefield, and you can't tell us where this money's going, how it's spent, and who's keeping track of it, and it took us half hour to find out who's responsible. Let me ask you one more. Denver reported thousands of airmail and ground packages at no cost. And then I got a letter here later explaining that, no, actually confirming this. Who's Bob Snyder, Chief of Staff?
He was the former VA chief.
Is he working at the VA now?
He is retired.
He's retired. How long was he there?
He, in various positions at VA for approximately 7 or 8 years.
Okay, 7 or 8 years, the Chief of Staff, Bob Snyder, who's now retired, sent a letter to this committee saying that sending out thousands of airmail packages costs $0. Is that possible?
No, sir.
Okay, so there's another problem with your smart problem.
It's obviously an error.
Okay. I mean, this committee hearing, Mr. Chairman, is very important for all of America to see that we have 265,000 people at the VA, that the taxpayers are funding at the cost of $180 billion, and we have our kids coming back from the battlefield that need help, and we have no sense of control that I can see at the VA, confirmed by you folks at the GSA, of spending $355 million per year on mail. So I think this has been very helpful, and I appreciate, Mr. Oswald, I'm not picking on you personally, but you're in the hot seat, and so are you. And so we appreciate you being here very much. I know you're going to fix this, and I will be watching. And the rest of the people on this committee will be watching. Thank you very much, Mr. Chairman. You have up my time.
Thank you, Mr. Poliquin. VA mail management, the case of the $11,257,000 package. That was the title of this hearing. You know, it kind of sounds like a sleuthing show you'd see on TV. When you peeled the onion back, it just appeared as though nobody had peeled the onion back from a management and oversight perspective along to see what was happening. We didn't spend $11,257 on a package, but that is a symptom of a root cause that nobody thought to see, to check, to wonder. That's unnerving at best. Thank you, witnesses, for being with us today and sharing your testimony. The panel is now excused. The mail management problems that we have discussed this morning seem to be symptoms, as I mentioned earlier, of deep-seated organizational challenges within the VA. We hear about them all the time. VBA and VHA do not cooperate. Facilities throughout the country operate dramatically different. The central office does not know what the field is doing, and I would suggest to you vice versa. The contracts, to say the least, are in disarray, but certainly don't represent some kind of a standard operating procedure and implementation that allows for best pricing across the spectrum. Policy is outdated. IT is inadequate. We are all familiar with the saying, if you've seen one VA hospital, you've seen one VA hospital. Apparently, it is also true that if you've seen one VA mailroom, you've seen one VA mailroom. You know, my background in flying and in Marine Corps operations, standardized, monitored operations are paramount to the success of the organization. Standardized starts from communications from the top down, input from the bottom up, and then the higher headquarters, in this case, those higher levels of the VA, coming out with standardized operations that can be executed locally to the best effort and the best outcome. We don't have that. If anything should be predictable and efficient, it is a mailroom. This is not changing environment every day. The mailroom workers and the mail managers should know that what they do is important, that they do serve a purpose of, number one, literally delivering the mail, but number two, being accountable for doing it right. It is one of the building blocks that the rest of the VA operations rely on. I expect the departments to devote sufficient talent and energy to implementing GAO's recommendations and not only fixing the abysmal situation, but looking forward to see how we create it for the future. Because mail delivered today is not going to be delivered the same way 5 or 10 years from now. We need to be on the leading edge of the curve, not on the tail end that's getting whipsawed around by the inefficiencies of a detached bureaucracy. Further, I would ask that the VA clean up the SMART data when it reports this year. I hope that next time someone reports an $11,257 package or any other bizarre entries mentioned today, a reviewer, it sends red flags, it sends whatever you want to call it, out, and people start to question it at the lowest level. Say, hey, does this seem right? Because if you don't, you're not making progress. And as we've talked about in various oversight and investigation hearings, there is that sense of urgency. I'm still, after this hearing this morning, not feeling that sense of urgency, and I'll add one more term to it, skin in the game at all levels of those who draw a paycheck in support of operations for our veterans and their care and their well-being. I want to see the sense of urgency, and I know the whole panel does, because when you look at all the committee work we do here on the Hill, this committee is absolutely one of the most bipartisan, singularly focused on doing what's right for the veterans of any committee that exists. I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and to include extraneous material. Without objection, so ordered. I would like to once again thank our witnesses and audience members for joining us here this morning. This hearing is now adjourned.